As the rates of diabetes in the U.S. continue to rise, diabetic retinopathy remains one of the leading causes of blindness in adults. Earlier, more accurate detection of retinal pathology is crucial to the successful management of diabetic retinopathy. When compared to traditional examination techniques, the use of OptoMap ultra-widefield retinal imaging technology from Optos facilitates a more rapid visualization of a much larger area of the retinal periphery, resulting in earlier diagnosis, better evaluation, and more effective treatment options. With the use of ultra-widefield imaging, retinal images are obtained more quickly, without the need for dilation. In addition, ultra-widefield color imaging capable of viewing more than 80% or 200 degrees of the retina allows for better viewing of the periphery for diagnostic purposes. This is evident, as you can see, from the comparison of OptoMap images versus those taken with more traditional fundus imaging devices, such as widefield, fundus camera, and indirect and direct ophthalmoscopes. As you can see from this infographic, the number of people with diabetes worldwide continues to escalate, and detection and treatment will become increasingly important. Clinical evidence has shown that ultra-widefield imaging can improve the detection of diabetic retinopathy. In the assessment of diabetic retinopathy and diabetic macular edema, ultra-widefield images have been found to be comparable to the gold standard Early Treatment of Diabetic Retinopathy Study, ETDRS, 7-field color fundus photographs. Ultra-widefield imaging and ultra-widefield fluorescein angiography, FA, improve detection and classification by revealing early signs of diabetic retinopathy that may be missed in traditional assessment. The presence of peripheral lesions identified by ultra-widefield imaging may indicate a greater degree of diabetic retinopathy severity. Clinical evidence from studies incorporating ultra-widefield imaging is changing the understanding of diabetic retinopathy, as well as the treatment approaches based on evolving clinical standards. A diagnosis of severe non-proliferative diabetic retinopathy based on findings from the peripheral retina is likely to be made earlier than one based on the criteria of the ETDRS 4-to-1 rule. A recent clinical study has found that eyes with predominantly peripheral lesions, defined as outside of ETDRS 7 standard field, had a 4.7-fold increased risk of progression to proliferative diabetic retinopathy, PDR, and they had a 3.2-fold risk of two-step progression in DR. Ultra-widefield imaging has demonstrated that diabetic lesions occur in the retinal periphery in up to 40% of eyes, and these lesions might result in a more severe grade of retinopathy in 10% of eyes. Without ultra-widefield retinal imaging technology, pathology in the retinal periphery may go undetected, resulting in greater disease progression and possible loss of vision. For more information on ultra-widefield retinal imaging, please visit our website at www.optos.com.